Hi, ladies. Today is Sunday, January 17th, 2021, 79 weeks postpartum. That's roughly 18 months and a little under 2 weeks. So I just wanted to give you a quick update on my possible next IVF round. I'm not sure if I want to go through with it yet or not. I kind of feel a little differently about IVF this time around. I think it's primarily because of the pandemic. If you are familiar with IVF, you know that you ultimately have to go in. Once you start the medication, you're going in to get um, ultrasounds and vaginal ultrasounds and or intervaginal ultrasounds and blood work pretty much every day. And if you are successful and lucky enough to get pregnant, then you continue to go in for who knows how long. It will vary, to get your progesterone levels checked, because you continue to take progesterone shots, um, or some sort of progesterone supplementation generally. So that varies for everyone. So an IVF cycle usually doesn't last too long, maybe 2.5 weeks. I guess it could go 3 weeks. For some people, my first cycle actually was only like 8 days. And then, after that, they triggered and I had a successful cycle. So I ended up being pregnant, but I did have to continue going to do blood work for progesterone. No more ultrasounds all the time, but the progesterones. The ultrasounds was more so for the pregnancy because now you're pregnant. Um, but still, like, just because of the virus out there, I do not want to go to the doctor's office every day if that's not required. Now, with IVF, that would be required because it is very important that they check you. They cannot be done virtually, so it's very important that they check you to make sure everything's fine, to make sure you're not having any complications. So you have to go in and get the blood work and the ultrasounds, and to make sure the medication is the injections that you're giving yourself are working as well. So but I know they're taking precautions. They did tell me that before you even start the medication, you have to have a negative COVID test, and then 3 days before the retrieval, you would have to have a negative COVID test. I don't know if it might have been before they trigger you, but I think it might have been 3 days before the retrieval. You have to have a negative COVID test, and if you do not, then they cancel your cycle either time. So they are trying to take precautions, but that does not mean that during that process there are not people there who are testing positive or who have the virus, and then by constantly going into the office you are exposing yourself. So I kind of feel a little more like the process is a little more daunting for me this time, than I did last time, where I was all gung-ho. So this is a follow-up to my video where I talked about my initial consultation with the doctor. So I went on Thursday and I had a visit with her, and she did an interuterine ultrasound, and very normal for IVF. And if you choose to do IVF, you got to get comfortable with that. And so, which it doesn't hurt or anything. So she did that, and she said everything looked great. Actually, there was no scarring, which was something she was concerned about. She was concerned about scarring because I haven't had a period yet. Well, I haven't had a period in quite some time, almost 18 months. I mean, actually more if you count the pregnancy, but I did get a period at 6 weeks postpartum, and then I haven't had a period since. And so she wanted to know if there was some sort of scar tissue. There wasn't. She wanted to know if there was some sort of blockage. She did not see anything. She actually saw that I had quite a lot of eggs. She said both the left and right ovary had quite a lot of eggs, so she thought that was really good. She said my uterus looked good, everything looked great. Interesting was she noticed that on the left side it looked like I had recently ovulated, so that was interesting to know that I was still ovulating despite the fact that I had not had a period. But this is now we're at a situation where she wants to see, because ovulation without fertilization usually leads to the uterine lining being shedded, and that leads to a period. So she says that can take 12 to 14 days plus 2 or something like that. And so basically 2 weeks. And but depending on when you ovulated. So she told me that like within 2 weeks I should expect a period. And if I don't get a period, then she's going to probably be concerned again. And she said there could be a small blockage that she cannot see on the screen, and that maybe they would have to do some sort of like inpatient surgery to remove the blockage. She says very minor. They go in, but it's always minor for them, and they go in and just, go through to make sure there's no blockages. And I'm like, is that really necessary though? Because just because I ovulated and if, and I'm not pregnant and I don't have a period, but I am still breastfeeding. And my understanding is that breastfeeding moms can ovulate and not have a period. But for some reason, this doctor seems to think that it means I'm broken in some way or something's wrong. And she keeps referring to me as a mystery. She was like, it's such a mystery, but we'll figure it out. And I'm like, is it though? Is it really a mystery? Could it simply be because I'm still breastfeeding that, I'm not getting a period even though I am ovulating? So I don't know. I'm just telling you what she said, and my thoughts are that I don't want to do anything, even if it's a small, minor inpatient surgery. I don't want her outpatient. What's the I think it's outpatient. I don't know. The one that's they claim is nothing. You're in and out. You're not admitted. So I guess it's outpatient surgery. I don't really want to do anything like that. Because I'm not sure if it's necessary. And you don't see a blockage. Like you say you don't see a blockage. And she said it could be a really small blockage that she doesn't see, but she even doubled down and said, but she doesn't know where there could be a blockage because everything looks great. So I'm just like, so what are we doing? We're going to do this for fun? Anyway, so they did blood work because she also wanted to do blood work to confirm that I'm not pregnant and also to see where all my hormone levels were. She said all my hormone levels look fine. My prolactin level was slightly elevated. Normal prolactin level, I think, was up to 28. I was at 32. So she said not a big deal, slightly elevated, which is to be expected because I am still nursing. I don't nurse all the time. I nurse, it was 3 or 4 times a day. I'm trying to get her down to 2. And sometimes that's enough to trigger a period. However, it doesn't matter because for IVF, if I want to do IVF, she did tell me I had to wean. She said the reason I had to wean was because the medications could travel through the milk. And in my case, I don't have a period. Now, most women will get a period while they're breastfeeding. And so you don't necessarily need to wean to get a period. But in my case, I haven't had a period yet. So we do think that it could be the breastfeeding suppressing it. I think that, and the lactation consultant I spoke to said that's highly likely, given that the doctor does not see anything wrong. But even though the doctor does not see anything wrong, I think she wants to go on a quest to try to remove a phantom blockage, possibly. So it's really weird though, because I spoke to one of the nurses who actually called to give me the results of my blood test. And she said that she didn't mention the surgery. She said, well, if you don't get a period in 2 weeks, we could actually force one with medication. She mentioned that there is a pill that you could take orally, that you only take it for about a week, and that at the end of that week, you should, you should get a period. Doctor never mentioned this pill to me. She went from, if you don't get a period, we might want to consider trying to remove, see about removing any blockages that she doesn't even know exist. And I'm like, there's a pill? Why didn't she mention a pill? Pill seems a lot easier if I wanted to go that route. And so she said, so I mentioned it to the nurse that the doctor didn't, the doctor mentioned possibly remove, going through to remove blockages, any blockage. And she said, interesting. And I'm like, you don't really want to hear interesting. You want to hear, like, the nurse was like, oh, well, we have a pill. So I'm like, yeah, that seems a lot easier if I want to go this route. And she said, yeah, we can give you the pill and that can help fast track your IVF process. So again, I would still have to wean, but completely, but it's just, I don't know. I don't know what I want to do right now. Like, if I don't get a period in 2 weeks, right now I'm thinking I'm just going to, I don't know. They told me if I don't get a period, or even if I get a period, to call them in 2 weeks. So they want to know. But if I don't get one, I'm sure she's going to want me to come back in, and she's going to try to do some other exploration measures. And then if I do get one, I guess they'll say, okay, great, wean completely, and then you can start your IVF, assuming you don't have COVID. So I don't know what I'm going to do. I don't like that this doctor keeps calling me a mystery. I don't like that she thinks that if I don't get a period that there may be a blockage. I discussed that with the nurse, and the nurse was like, oh, that doesn't mean there's a blockage. It is it does happen. Even their nurse said it does happen that women who are still breastfeeding don't get periods. It is common. It does not make anything wrong. I mean, it's also common to get your period. It varies. Everybody's body, every pregnancy is different. So even if you have, or you have another baby, you breastfeed, doesn't mean you'll go 18 plus months without a period. So we'll see. I don't know what I'm gonna do yet, but just wanted to give you an update. It's funny because I was thinking about trying naturally, which seems so foreign to me. I'm like, do people try naturally for babies? And like joking, like I haven't tried naturally really, and I wasn't even sure that I was ovulating. And now that I know that my body has started ovulating, I'm assuming it will keep this up. And so I could just try naturally and see what happens and go from there. But it's such a foreign idea to me. It's so funny because I'm like, I feel almost like I have to use some assisted measure. And, there was never any diagnosis that said that I had any sort of problem, meaning that would prevent natural pregnancy. So I'm thinking I might try that. I know I'm acting like it's so weird, but I'm thinking I might try that measure even before going back to this doctor, if I go back. So I'm not sure what I'm going to do, but just the fact that I don't have a period right now, or I mean, I could get one, but since I haven't had one yet, they just make me seem like I'm an alien, and it just was like, come on, Like the lactation consultant said, most moms don't go out 18 months or even a year breastfeeding. So to see someone who's 18 months out and still breastfeeding, for a lot of these doctors is odd, and it's so they don't know what to make of it. And I'm like, is it really that odd though? A lot of people do extended breastfeeding. I mean, my mother breastfed me until I was 2. And so Michaela's not even 2, and I'm being like looked at like, it's like, what is wrong with her? And my mom actually told me she didn't have a period for the 2 years that she breastfed me. So maybe it's hereditary. I don't know. But I just wanted to give you an update. I'll keep you posted. And feel free to share your thoughts. And I will talk to you soon. Stay safe.